Thank you, everyone, for joining us today. I'm Rachel Sarvey. I'm the Director of Development at Silent Spring Institute. For those of you who don't know, Silent Spring is a leading research institute dedicated to studying the links between the environment and breast cancer. If this is your first Science Cafe, welcome. Our Science Cafes feature conversations with experts on a variety of topics related to breast cancer and environmental health and are made possible thanks to generous contributions to Silent Spring Institute. Thank you for all of our donors who I know you are here, and I see you and I appreciate you for supporting these events and our science. I also want to note that this is the last Science Cafe of the season. Stay tuned for next season's lineup. A few details about today's event. Our moderator, Dr. Beth Whelan, will guide the conversation for about 45 minutes. Then we'll open up the program for the entire group, and you can submit questions via the chat. The program will be recorded, and made public. We invite you to keep your cameras on if you're comfortable doing so. We also request that you please keep yourselves muted. Throughout the program, you can send any questions for our speakers to ask a question from the drop-down menu in the chat. And at the end of the program, Alex Goho, our Director of Communications, will ask questions of the panelists from that list. So let's get started. I'm delighted to introduce you to our host, board member, and chair of our Leadership Council, Dr. Beth Whelan. Before joining Silent Spring's Board of Directors, Beth worked at the Centers for Disease Control and Prevention, where she was a senior research epidemiologist at the National Institute for Occupational Safety and Health. We're very fortunate to have Beth on our board and to have her moderate today's Science Cafe. And with that, I'm going to hand things over to Beth.
Great. Thank you, Rachel, for that introduction, and welcome to everyone. As you all may know, this is a very challenging and uncertain time for research on environmental exposures and women's health. Federal funding for important exposure science is actively being reduced or eliminated, even as of yesterday. Silent Spring Institute is very important to the landscape of independent research about environmental chemicals and women's health. And this is why your support for this kind of science matters more than ever. So please keep us in mind as you make your charitable giving decisions. April is also National Healthy Homes Month, and what better way to kick things off than with a conversation about our homes, how everything from the materials used to build them to the furnishings and products we bring into them can impact our health and well-being. To help guide us through this topic, I'm joined by two nationally recognized experts in the field. Dr. Robin Dodson is an exposure scientist at Silent Spring. She's an expert in studying how people are exposed to chemicals in their everyday environments. Her research focuses on developing new ways to measure people's exposures to chemicals for community-based and epidemiologic studies and designing interventions aimed at reducing harmful exposures. Robin has a doctorate in environmental health and a master's in environmental science and risk management from the Harvard T.H. Chan School of Public Health. Also with us is Amanda Reddy, Executive Director of the National Center for Healthy Housing and a Silent Spring collaborator. Her work focuses on creating better health through better housing. For 15 years, Amanda has worked with communities to prevent housing-related illness and injury by implementing evidence-based and equitable policies that improve housing quality. She holds degrees in environmental health from the London School of Hygiene and Tropical Medicine and neuroscience from Mount Holyoke College. Welcome to both of you. It's great to have you both here today. So starting with you, Robin, as an exposure scientist at Silent Spring, you've dedicated your career to studying consumer product chemicals, specifically people's exposure to these chemicals indoors, in and around their homes. What inspired you to focus on the indoor spaces?
Sure. Thanks, Beth. And it is wonderful to be here with you all today. My focus on the indoor spaces really comes out of the fact that when people think about pollution, they probably think about pollution coming from a smokestack outdoors, and may not realize that actually pollution levels tend to be orders of magnitude higher in the indoor environment, and that includes in our house. And so that's because of a variety of different reasons. That could be just because we have more intimate contact in the indoor environment. We're more closely interact with those sources. But also because chemicals tend to stick around once they enter the indoor environment, since it is so protected. And the indoor exposures really matter because we spend a lot of time there. And in fact, our kids spend a lot of time there. And those kids can be exposed to chemicals that can affect their health and affect their development. We started at Silent Spring studying indoor exposures to chemicals way back, almost 25 or more than 25 years ago in our Silent Springs household exposure study. This was part of our larger study on Cape Cod at the time. And it was really we were the first to actually measure some of these consumer product chemicals indoors, and the fact that they might leach out of products and get into our air and our dust. And it really kind of pushed the field forward. EPA, after our research came out, started thinking about how they should not only focus on the outdoor environment, but also consider the indoor environment as they're thinking about regulating pollution.
That's great. So what came out of the household exposure study? What impact did it have?
Yeah, so the household exposure study was part of the larger Cape Cod breast cancer and environment study. And we were the first to measure many consumer product chemicals, many of which are considered endocrine disrupting chemicals, and showed that the major source of these exposures are inside of the house. And it really laid the groundwork for future research in this area, not only of our research, so we've done additional exposure studies and intervention studies, but also the research of others in the field. So for example, we followed our first household exposure study with a California-based household exposure study that was done in a community that sits just adjacent to actually the largest refinery in North America. And again, it was really important to try to demonstrate and understand a bit more about what is going on in the indoor environment relative to the outdoor environment. We also followed that work. We've done a bunch of work on campus, college campuses, in public housing, and it's really kind of launched a lot of my research over the last 15 years or so here at Silent Spring. I'm really excited because not only has it launched a lot of my research, but it's also led to some really incredible changes or impacts. For example, I spent a lot of years studying flame retardant chemicals, and thankfully our research, along with others, has led to changes in the furniture flammability standards. That's great. It means we can now buy furniture without toxic flame retardants in them, which were shown to be ineffective as they were used. And now we can create homes that are a bit healthier without those toxic carcinogenic chemicals. And work is really important because it's really kind of flipping the narrative that says that chemicals are put into products and they just tend to stay there. Rather, our research has shown that otherwise, that these chemicals, as they're brought into the home and the materials that we build our homes with, or the products that we use, that these chemicals can move out of the products and into our homes and into us.
Mm-hmm. Yeah, it's really worrisome. Yeah, so just a word back about the California study. I know that was unique in that you worked with the community on that. You mentioned the refinery, but the community was involved in the study. Is that right?
Yes, we work very closely with Communities for Better Environment, which is a local environmental justice community community organization there in California, and it was really instrumental. We do a lot of our work based in community or in collaboration with community, and it is extremely important. It allows us to do research that is more targeted towards community needs and questions, but it also improves our research tremendously. Working very closely with community partners, we've found that we've had increased participation amongst community members, we've had better retention, and just we're learning a lot more because of that close collaboration that we have with community organizations.
Yeah, it's wonderful. That's great. Now, let me turn to you, Amanda. Robin just described the hazards of consumer product chemicals in the home, but the ways that our homes impact our health in the field of healthy housing goes broader than that, right?
Absolutely. And, Robin, first of all, I loved what you said there about, the fact that people think about air pollution being outside, right? And not necessarily inside. In the field of healthy housing, we have a phrase that what's outside gets inside and what's inside builds up, right? And that's a sort of easy way for us to sort of remember that concept. And you also mentioned about how much time we spend in indoor environments. I think a lot of us, just even the general public has heard that statistic that we spend on average about 90% of our time in indoor environments. I think what people don't realize is from that same survey that comes from the National Human Activity Pattern Survey, they found that we spend 70% of our time on average in residential environments. So it's not just that we spend time inside. We spend time in homes, in and around homes. And you can imagine for certain populations, if you are very old or very young, for instance, a majority of children under the age of 5 in this country receive care in residential environments, in whether their own home, a relative's home, family-based childcare. If you have certain types of disabilities, if you work from home, right? Many of us may be spending even more time in our home environments, which really makes it one of the most powerful opportunities we have for really transforming people's health and well-being. And it's also important, for most of us, homes provide shelter and security and are just the epicenter of our lives. And I think it's, intuitive, and we actually have research on this, that it's intuitive that people understand the connection between health and housing, and that housing can impact our lives in interrelated ways, including, can you afford where you live? Where is your home located? What's outside? Is it safe to go outside? Is the air safe to breathe outside? But also, really importantly, the quality and condition of our homes. How are our homes designed, constructed, maintained? How are we using and interacting with our home environments? That occupant behavior piece doesn't always get talked about enough in our field, but it can be really important, right? The issue isn't necessarily just gas stoves, but are we ventilating properly in our homes, for instance? And so that homes that are poorly constructed or maintained can have really profound impacts on our health and well-being through a variety of different biological, chemical, and structural agents, including some, all of those that you see on your screen and more. These really make up sort of the traditional foundation of what healthy housing has traditionally been perceived to encompass in our field. And about 40% of our homes in this country, and that's true whether we're talking about urban communities or rural communities, have at least one health or safety hazard among these that can impact people's health and well-being, can cause illness, injury, even death. About 40% of our homes, and we know that in certain communities that proportion is much higher, right? These conditions are not equally dispersed, and these exposure to substandard housing has serious health consequences, ranging, from things that we might think of immediately, like the impact on respiratory conditions or allergic conditions, lead poisoning, which has gotten more press in the last decade, but a host of other types of outcomes as well, including, heart disease and cancer, mental health outcomes. An interesting set of studies has come out over the last decade showing that housing quality, even compared to housing stability or affordability, has the most profound and robust association with mental health outcomes for children and adolescents, or infectious disease. Healthy housing had its roots in infectious disease. That's how the field got started. But it faded for a while until, something happened about 5 years ago when people got interested in it again. And there was a really interesting study that came out in the first year of the COVID pandemic, looking at a county analysis across the country and identifying that even controlling for all other known risk factors, that the percentage of substandard housing in a county was a very strong predictor of COVID incidence, but also COVID severity and COVID mortality, right? Your housing is absolutely impacting, whether you live or die in some cases. And it's really important to note that, and sometimes when we're talking to people about healthy housing, we'll put that list of conditions and this list of health conditions side by side, and we'll have people map out the connections, right? And it starts off pretty basic. Radon causes lung cancer, asthma, cockroaches cause asthma attacks, right? But then people will say like, oh, you can die from an asthma attack. Oh, well, you can die from lung cancer also, right? And what you see is just a web, right? A very complicated web. And that's a really important message here as we talk about this and talk about expanding our understanding here of healthy housing, is that a really fundamental concept here is that the problems are related, but so are the solutions. And that presents a real opportunity for public health. And this is really codified in a set of principles, sometimes referred to as the principles of a healthy home, or the keep it principles: keep it dry, keep it clean. What you see on your screen right now are the 8 healthy homes principles. There were 7 originally, but the 8 that are currently recognized by the U.S. Department of Housing and Urban Development. So noting we started with 7, we moved to 8 as a nation. If you click one more time, there are an additional 3 that NCHH currently recognizes. We currently recognize 3 additional principles for a total of 11. I'm really just demonstrating the evolution of this field. And our organization really exists to address this need, right? This particular aspect of how housing impacts our health. For those of you who may be hearing about us for the first time today, just briefly, our role in this space is that we're not people who are on the front lines. I'm going in to find and fix these hazards. Sometimes when people start talking to me, they imagine I've got a staff full of people with hard hats and like power tools. That's not our role in this space. Instead, we exist and our role has been through a combination of research. We have a very strong research arm. If you look at the last 3 decades of healthy housing policy and practice, you'll see NCHH authors all over that. We do a lot of advocacy at the federal, state, and local level. And then we do a lot of capacity building to make sure that those who are on the front lines, governmental, non-governmental agencies, healthcare providers, practitioners, and lots of different spaces, that they are equipped with the best evidence, tools, resources, funding that they need to get the job done.
Great. Thank you, Amanda. And, thinking about all the time we spend in our homes and all the various things we do in our homes, it comes to mind also that we need to remember there are a lot of people who work in people's homes. And
that's exactly right.
Lots of different homes. So we have, people doing, home health care and cleaning, house cleaners, and they're exposed to a wide variety potentially of different kinds of homes and different levels of, exposures.
And they don't have control over those environments quite often. Yeah, great point.
So Amanda, how did you become connected to Silent Spring?
Sure. Well, I mean, the simple answer is Robin, because Robin's wonderful, and reached out and built this partnership. I think, the most obvious connection for those of you who are familiar with Silent Spring, as you were looking at that previous screen of the healthy housing principles, you probably zeroed in on keep it contaminant free. Right, that's an obvious connection there, thinking about keeping, reducing chemical exposures in our home, whether we're thinking about lead or radon, pesticides, VOCs, environmental tobacco smoke, many other types of exposures that we could list there. But there are also important connections, I think, here between Silent Spring and other principles too, that may not be as obvious. For instance, there's one of the principles is about keep it pest free, right? How do we keep pests like cockroaches and rodents out of our homes? And how we do that includes important choices about how we are or are not using chemicals, and which chemicals we're using and how we're applying them, and how what implications that has for exposures. Or the keep it clean principle, a key intervention in healthy housing for many years has been about creating smooth, cleanable surfaces that are easier to maintain and getting rid of those dust reservoirs. But the product choice matters there, right? What kind of flooring we're replacing that carpeting with matters in terms of making sure that we're not just exchanging one environmental exposure for another one. And I think a really great example of this is that there's often debate about whether something like lead is part of keep it contaminant free, or keep it maintained, or keep it safe, or you could make an argument for keep it dry because moisture helps, to degrade lead-based paint and make it available. There are a number of ways that we could think about this, and lead is one of our more straightforward issues. We have more than 4 decades of research and work since we first banned use of lead paint in residential applications here, and a scientific consensus that there's no safe level of lead exposure, right? That's true whether we're talking about lead in people or lead in the dust in our homes. Just to, for those of you who may not be used to thinking about lead as one of the chemicals that you're hearing about, to give you an idea of how little lead is needed to be a problem in people's home. If you think about a standard sugar packet that you use to sweeten, maybe you used it this morning to sweeten your cup of tea or your coffee, and imagine that same packet filled with lead contaminated dust instead of sugar. Now spread it evenly across the entire space of a professional football field. That was still enough even before the most recent lowering of the EPA dust lead level standards, which have become lower. But even a year or 2 years ago, that was still enough for EPA to consider that a lead contaminated surface capable of poisoning a child and causing permanent harm to that child. And we continue to see, that threshold drop as I referenced, and we have lots of, I think, important lessons learned about what has really been an overwhelming public health success story for that particular chemical exposure. So there's a lot that we can learn there, but I think we have a lot to learn for other indoor air quality exposures, both those that the healthy housing field is already addressing, but also those that maybe we are just learning and sort of stepping into. And I think that's where our partnership with Silent Spring, really made sense, because of the common interest we have in things like lead and reducing pesticide use, but also because I think there's really significant opportunities for our field, for the field that I represent, to better understand the additive effects and interactions amongst some of these exposures and interventions, to expand the healthy housing field's understanding of the range of exposures we should be concerned about. All right, like we don't normally talk about things like flame retardants when we're going into people's homes, but we should be, right? There's no reason that we couldn't and shouldn't merge those efforts. And all of this really has significant applications for the actual on the ground work of the people who are going into tens of thousands of homes every year in this country, right? That is a significant opportunity to bring Silent Spring's message and particular expertise to real people every day. And yeah, so I mean, there was, I think, this obvious synergy that thankfully Robin and our colleague Katrina Korfmacher at the University of Rochester recognized. They came up with this idea of a study in Rochester, New York, and it really was a no-brainer for NCHH to enthusiastically join the study team, not just because of the expertise they thought we could bring, but because we knew what we would be able to learn from it as well.
Great. I really like that point you just made about, inspectors going into homes and so much more that they can carry as a message for public health. It's really such an opportunity. Yeah. So Robin, let's talk about the study, the Rochester study, Rock Home. It's looking at multiple chemical exposures in the home. Can you tell us a little bit more about it?
Sure, yes. Excuse me. So yeah, Rock Home stands for Rochester Housing-Based Opportunities to Minimize Exposures. And it was really started as a collaboration between Katrina Korfmacher and myself. Katrina has had a long history of working on housing-based issues in the Rochester area. Really an important part of Rochester's coalition to prevent lead poisoning, which has become kind of a national model of thinking about lead hazards inside the house. And HUD at the same time, so the Housing and Urban Development Agency is investing millions of dollars every year in lead hazard rehab or rehabilitation in Rochester and across the country. And so we came at this with a question about, well, if they're going in and spending all this money trying to mitigate one housing hazard, as Amanda mentioned, a lot of these are kind of related, right? And so what would happen to everything else inside the house during this rehabilitation period? So we got some funding from HUD through their Healthy Homes Technical Studies to create a longitudinal study. So that's a study over time where we collected data, really dust, before and after this lead rehab work. So what we did is we went right before, we went and we collected a lot of dust samples. The homes went through a HUD-funded, really city-funded rehabilitation program where they addressed major lead hazards inside of the house. And then we went back and collected a sample right after that work was done, and then 4 months later, because we wanted to try to understand a little bit of kind of the sustained effects. And not only are we looking at lead, which Amanda and her colleagues at NCHH have already previously shown have significantly declined as a result of this lead rehab work, but we decided to bring in other contaminants. So contaminants in the home that I spend a lot of time thinking about: flame retardants, phthalates, pesticides. All of these, just like lead, affect children's development. In addition, we also wanted to ask questions about whether or not engaging directly with residents could help. So what we did is we enrolled 86 residents in Rochester. These are low-income homeowners with children in the home that are participating in part of the City of Rochester's lead hazard control program. We collected our first sample way back in June 2021, and we just wrapped up sample collection this past spring. So we were managing a home-based study during the pandemic, which was no small feat, and because of the incredible work on the ground in Rochester to make this happen. So in addition to trying to understand the longitudinal or the kind of the time effects related to the lead hazard control, we were also very interested in understanding about how engaging directly with residents could kind of further improve housing conditions. So what we did is we took those 86 residents, we split half of them into a group that received this resident education. They got education, they got referrals, they also got this Healthy Homes kit that had kind of the necessary supplies to address common hazards inside the house. And then the other half participants went through the lead hazard control, and then we gave them all that education and the kit and everything at the end. This engagement and this education is built upon New York State has this program called the Healthy Neighborhood Program, which Amanda actually has written several papers on the effectiveness of that program. And the idea here is to say, okay, well, let's see what's happening with the lead rehab work, but let's also see, hey, could we amp up or could we kind of improve or amplify any of those effects if residents are directly engaged in understanding some kind of common healthy homes principles inside of their house, and try to see if we can see that difference. And this has really important implications for when you're thinking about how HUD and others might design these programs down the line.
Great. So yeah, before we talk about what you've learned from the study, I just want to chime in with a question about whether you think the recent cuts that we've learned about yesterday, for example, might affect the study and how.
Yes, so fortunately, we are actually wrapping up that study right now in terms of the funding. Right now, as far as we know, HUD hasn't been directly affected by those cuts, but we are able to, we've got a lot, we are kind of fortunate to be in a position right now that we've got a lot of data in, and now we need to analyze it. And so are looking towards kind of an analysis and dissemination of all of those research results.
Okay, good. So what have you learned so far from the project? Has there been anything surprising?
Yeah, so we've had just a first look at the data. And the good news is, as been shown previously, lead levels go down significantly over time. And this is wonderful news. We found significantly lower levels after the lead hazard control program versus before. So that is really great news and has been shown previously. And we see sustained effects over the 4 months afterwards. We've also found some kind of some interesting findings, like relatively simple steps like vacuuming at least once a week with a vacuum with a HEPA filter can actually significantly lower allergen levels. In this case, what we're looking at is mouse allergens. And that's great news for people who have asthma. Because it means that, or other respiratory concerns, because it means that that simple step can do a lot to reduce their exposure to something that might exacerbate their asthma or other respiratory health effects. And perhaps not surprising is that we are finding phthalates and flame retardants abundant in people's homes. I have collected hundreds and hundreds of samples in people's homes over the years, and I always find phthalates. Phthalates are found in they're these plasticizers. They're found in building materials like vinyl floors. Excuse me. They're also found in fragrance products like air fresheners or scented candles or scented cleaning products. We're also finding flame retardants. So I've mentioned those previously. Flame retardant chemicals are chemicals that are intentionally added to things like upholstered furniture or electronics, even insulation. And what we know based on our research is that those chemicals do not stay put. If they are added to a piece of furniture, if they are added to electronics or insulation, they eventually find their way into our homes. Most of these chemicals are you kind of think of them as kind of heavy. They'll be found in air, but they really like hanging out in dust. And that's actually how we measured them in the Rochester study. But these chemicals can find their way to dust and stay there. We've also found, as an example of a chemical that just likes to hang out and stay in dust, is that we've found DDT in a third of the homes. This actually isn't that surprising necessarily, but that's right, it's DDT. DDT was banned over 50 years ago, thanks to the work of Rachel Carson, and it is extremely persistent. And when you think about really persistent chemicals, in the indoor environment, they're even more persistent, because if you think about, there's really no great way for them to degrade over time. There's no rain or sunlight or wind. In fact, those chemicals like DDT that are persistent tend to stay put. So this becomes really a cautionary tale about about what we introduce into the house, because we cannot just turn off the tap. We cannot say, oh, DDT is banned, it will no longer be in homes. It's still in homes, and it's extremely hard to get rid of once it's been introduced. DDT is just one example of like these highly persistent chemicals that make their way into dust. And it can be difficult, but the good news here is that all of these chemicals that like to make their way into dust, one of the best ways to reduce our exposure to these chemicals is to actually keep dust levels low inside the house. And so that includes things like vacuuming with a HEPA filter. It includes things like wiping surfaces with a wet rag or a mop. All of that should reduce dust levels in our exposure to dust, which will therefore reduce our exposure to the chemicals that like to hang out and stick to dust.
So Robin, what was the source of the DDT, do you think?
We're not sure. I mean, DDT was widely used before its ban. In fact, we know it was applied, it could be applied to wallpaper, for example. So huge surfaces, if you think about inside the house, could have been treated with DDT prior to its ban. And again, it's one of those things, right? Like it was probably used that way 70 or 80 years ago. But that doesn't immediately leave when you ban the chemical. And if you're covering large areas of the house with those kind of sources, I know in the Cape Cod Household Exposure Study, for example, they talked to folks who were using DDT lined shelf paper, as well as spraying like their screens on their windows with DDT. It'll stick around for a long time, especially when it's applied in a lot of spaces like that.
Right. So it sounds like you've learned a lot and there's lots more to come. Have you shared the findings with the study participants yet?
Yeah, so, kind of in line with what's very important to Silent Spring and all the work that we do is that we share the data back with study participants. And so we created personalized study reports using our digital exposure report back interface, also known as Derby. And we were able to share those with study participants late last year. And each report includes not only the participants' results, and how we do that is that we put the level of their chemical found inside of the house relative to everybody else in the house, so they can kind of get an understanding of the variability in what we're seeing. But we also share rather overall study results. So things like the lead levels going down significantly. We share information about the chemicals that we're studying, things like what are their sources, what are their potential health effects. And we always provide evidence-based tips for participants who might wish to try to take steps to limit their exposure to these chemicals. We were able to leverage the original funding from HUD with some additional funding from NIH, actually, so that we could go back to participants' homes after they've received their results. And that's what we're doing right now, is we're actually going back to participants' homes and talking with them about their results and about what they learned as part of the study, which has been really rewarding. I think it's an important way to kind of almost close the loop on what we are understanding, what we shared during the study, and then what people are actually kind of taking in and acting upon. And I think it will be really important as we think ahead and thinking about designing what are feasible and actionable approaches for residents to take as they're trying to maintain a healthy home.
So Robin, are you going back to a certain subset or some kind of random sample, or those who agree, or how are you doing that?
Yeah, so of the 86 participants that we originally had, we got this funding and we're able to then start recruiting folks in, and we have about 54 of them are part of this sub-study. And in addition to actually being part of the sub-study so that we could go talk to them again, they also provided us with a urine sample. And so that allows us to answer additional questions about then what is the kind of the relationship between what we measure inside the house and the dust samples to their urine, so we can understand what's the contribution of the home in terms of their overall exposure to these chemicals. So we're still analyzing some of that data. That data is actually still coming in, the urine data. But yeah, so for a majority of our participants, we're able to kind of ask additional questions.
Fabulous. That's great. Okay, Amanda, turning back to you, what kind of impact do you hope these findings will have?
Well, if I'm being perfectly honest and candid in this moment, I think my answer to that question was probably a little bit different, or at least had some more specificity at the beginning of this project than it does today. And then it might look a little bit different again next week, just because our field is undergoing and experiencing an unprecedented amount of uncertainty about how this work is going to persist going forward. I think it's important to say it will persist. We will find a way, but there's a lot happening. We heard, at the top of this conversation about the, cuts at HHS yesterday for the field of healthy housing, specifically, within the National Center for Environmental Health, an entire division that houses the asthma program, the lead program, environmental public health tracking, the radon program, many others, was completely eliminated, just eliminated. And although, as Robin mentioned, we haven't heard that similar news from HUD yet, it doesn't mean that those threats don't exist. And I think it's important to note that all of these federal agencies' programs are related to each other. Those HUD programs and those investments depend on the services that CDC was providing, right? These are different legs of a stool and not duplicative. So there's a lot of uncertainty here, but again, that big picture hasn't changed. And I think there are important lessons already emerging from this work that can inform both the priorities and the practices of those who are funding this work and implementing these types of program, whether that continues to be HUD or through efforts funded by states or localities or private foundations or nonprofit organizations who are, coming in to fill the gap. And that includes things like both the scope of what we're assessing for, right? Like as Robin and I have both said, we don't normally ask about or look around to see about what might be potential sources of things like phthalates or flame retardants. So what are we looking for when we're in the home? And also, but the scope of the interventions and the education that we can provide to address exposures. And again, that it means addressing these new things. I love that the Silent Spring reports include those tips on how to reduce your exposures to these particular contaminants, but also, as I mentioned earlier, and Robin alluded to, that we are taking the opportunity to really take a critical look at the standard package of healthy housing interventions that are traditionally offered and make sure that we are not exchanging one harm for another one. So not, getting rid of pests and relying too heavily on pesticides. We've been pretty good on that for many, many years. We talked about the type of flooring replacements and thinking about that, or cleaning products that we might be recommending to folks as they are trying to address some of these other healthy housing issues. So I think there are important implications for the field in those ways. I think also, this last question that you and Robin talked about in terms of the report back to participants, that's something that's very important to NCHH, and something that we have a message we've tried to bring to the healthy housing field. But I've really appreciated the conversation and the ongoing sort of mutual learning with Silent Spring here about just really the conversations that people deserve to know, even when we don't have clear answers, that people may still have a right to know what they're being exposed to in their environment, to really think about how we communicate about complex technical topics, even when we don't have clear answers, and that this message that it doesn't have to be all or nothing, we don't have to have a perfect answer, that there are steps that we can take to reduce exposures can really be empowering as well. So yeah, I think there are just a number of ways that I'm really excited about this, helping us to continue to expand our understanding of the role of housing.
That's great. And the other thing that strikes me related to what you just said is just the power in the individual actions, that people can take to drive change in the marketplace. For example, I don't know if either of you want to say something about that, but I think that's much more powerful than we give it credit for.
I think so. And I think if we think about our own personal lives, right, and how, especially with the kind of technology and the way the platforms we have to share information today, if we can find ways to package this information, we can really actually launch a movement pretty quickly and get people equipped and to make healthier choices for themselves and their families.
Yeah. So staying with you, Amanda, and thinking about building materials, The fires in Los Angeles really focused people's attention on the impact of extreme weather events on housing, specifically toxic chemicals that are released during the fire. How are you factoring climate change into your work?
Climate change is a big part of NCHH's work and has been for a while, because housing is central. It has to be central to our response to a changing climate, both from what we call an adaptation perspective and a mitigation perspective. So, for on the mitigation side, that's how do we actually sort of slow our carbon emissions and our contribution to climate change. 20% of our carbon emissions in the United States come from the residential sector, largely through our use of heating and cooling our homes. So that's a really important opportunity, right, to see homes as important to that strategy. But homes are also where we take shelter from events like flooding or high wind events like hurricanes or tornadoes, extreme heat, extreme cold, wildfires, as you mentioned in the question. And they really need to be safe places for us to be, both in terms of protecting us from the extreme weather threat itself, but also, so again, we aren't trading one exposure for another, right? We don't want to be sheltering from extreme heat for a long season inside of our homes, but increasing our exposure to lead or to DDT that's persisting in our homes, right? We have to be able to address both, and it really is an opportunity to address both legacy and emerging environmental justice threats. And there's a lot of great examples from our field about potential co-benefits of investing in both climate and health outcomes. And for instance, we did a study in the past couple of years here at NCHH on gas stove use, right? That's been something that's been making headline. Many of you may have seen the study that was published by our colleagues at the Rocky Mountain Institute, attributing like 12% of childhood asthma to secondhand to gas stove use in multifamily housing, right? It made it basically equivalent to exposure to secondhand smoke in terms of its contribution to asthma, and everybody would agree, right? I hope everyone would agree we shouldn't be exposing children to secondhand smoke, right? That we all agree on that. And so our organization was participating in some additional research and led some additional research looking at ventilation as an option, right? To control the combustion byproducts from gas use, gas stove use and gas appliance use in multifamily housing. And there are some really important findings from that work, including that we were able to see reductions if we introduced ashtray level mechanical ventilation, which, let me be clear, most of us do not have access to that kind of continuous mechanical ventilation in our homes. But even with that standard, we saw reductions of those combustion byproducts. They were not eliminated, significant reductions in most of them, but not all. And so that, right, the ventilation is not a complete solution. And so that really helps to bolster the argument for electrification of buildings and, over time, perhaps encouraging and supporting residents in exchanging gas appliances for electric ones, which can, again, reduce the energy emissions of that home, but also then create a significant health benefit. And we have several more in that sort of similar vein. And I think you mentioned at the start here fires, and I think that in fires in particular, highlight the challenges, I think, with who has access to shelter, right? Not everybody even has access to to safe places to shelter, what kind of ventilation they do have access to, right, if any, and how much control they have over that ventilation system, the trauma of potentially losing your home, right? Not just whether it's a safe place to be, or entire community, but also then, as you mentioned, the secondary waves of exposure from chemicals released, in the example of a fire, which is not dissimilar to the additional waves of exposure threats we see from other events like mold after flooding, right? Like you just get past the initial thing and then here's this secondary threat that's coming in, or people trying to stay warm in parts of the country that don't usually experience extreme cold, or even in places that do experience extreme cold, but there are power outages and having unsafe practices and increasing their exposure to carbon monoxide. We see carbon monoxide deaths spike in and around those events from people just trying to make it through. So I think those kinds of events really do bring the importance of housing and safe housing into sharp focus. And I think it's really, a key message here for me is that these problems are real, but the solutions are too. And I think it's really important that you asked about that in particular. There is a really interesting report, for instance, from the Frameworks Institute, who does a lot of really interesting social science research, sort of understanding lay people and expert understanding of complex issues. And they have one on this topic of healthy housing. And one thing that they found in this report about healthy housing is that people generally understand the connection between housing and health, right? It's not that complicated. People get it. But they also, at the same time, perceive housing as this big, complex, unsolvable problem, right? It's bad tenants, it's bad, greedy landlords, right? We can't fix it. It's this broken system. And so what do we do? My team, just like Silent Spring, is mostly scientists by training. What are we trained to do? We spend 90% of our airtime talking about the problem, right? We think we're trying to convince people there's a problem. The people don't need to be convinced. They get it already. Instead, what we're doing is reinforcing this idea that these are complex, unsolvable problems. And so I think it is really important to sort of pivot and talk about solutions like healthier, more resilient materials. And I think that there's a lot of opportunity here.
Great, thank you for that. Robin, the COVID pandemic pushed people to come up with solutions for improving indoor air quality. Did that work extend to addressing consumer product chemicals as well?
Yeah, I think so. So the COVID pandemic really shone a light on a lot of things that we typically think about when we think about improving indoor air quality. Things like ventilation, right? Like the importance of adequate ventilation, as Amanda has talked about, can go a long way. So it's really focused our attention on ventilation in our homes, but also schools and offices. It also, I think, helped again show that make more visible the invisible threats, right? So making the invisible threats more visible is really is important. You don't see the chemicals that I study. You can't look around your home and see them, and so it's important that we kind of bring those to light, and so people understand them. I think the COVID pandemic also reinforce the fact that we have vulnerable populations. We have people who are dealing with comorbidities, they have other health conditions, and that we have people who are already burdened by pollution and other experiences that that is only amplified or made greater because of the pandemic, because of the airborne coronavirus. So one thing, again, is talking about Amanda's moving towards solutions, is that, we could study that up and down and try to understand a bit more about it. But I actually had the opportunity to have collaborated with a faculty member at Brown School of Public Health named Joe Braun. And we took advantage kind of a moment at the School of Public Health, where they were installing these Corsi Rosenthal boxes. These are these DIY air filters inside of classrooms at the School of Public Health to mitigate COVID. And we came at it with a research question to ask, well, are there other co-benefits to putting the Corsi Rosenthal boxes inside classrooms? And in fact, what we found was that by installing these Corsi Rosenthal boxes, that not only was it doing a great job at mitigating COVID risk, but it also significantly reduced levels of phthalates and PFAS. These are these forever chemicals, these highly fluorinated chemicals in indoor air. So that's wonderful, right? So this DIY filter that's relatively easy to make and inexpensive to make. In fact, we had these box making parties at Brown where we all got together and we made a bunch of boxes because we had to make like 20 or so at a time, and put them inside the classrooms. And there's these other ways that we can think about how we can develop these interventions that can have impacts in other ways, not as they're just traditionally thought of. And I think we really need to kind of capitalize or use that thinking about right? While we're going into people's homes, we might as well tell them about other things. While we're trying to mitigate some exposures inside, say, classrooms, what are the other ways that we can improve the conditions inside these buildings? So just kind of one example of the way that we're trying to think broader and more solutions focused in our research.
Fantastic. That's great. So now that you're wrapping up the Rock Home study, Robin, what's next?
Yeah, so we're very excited because we did receive another round of funding from HUD through their Healthy Homes Technical Study. And in fact, this project started just yesterday on April 1st. And this study is over the next 3 years will allow us to continue our work in this space. So we'll be collaborating with Amanda and the National Center for Healthy Housing, again, with our partners in Rochester. And what we're doing is we're developing a children's healthy home app for home visiting programs. So millions of home visits happen every year. So these are like community health workers or other early intervention programs. These home visits are going into people's homes, particularly with families that have young children. And so what we want to do is leverage that interaction with families to increase environmental health knowledge. So we're creating an app to support the home visitors as they go inside of homes. We're going to test this out first. We're going to test it in a couple communities, including back in Rochester and Alexandria, Virginia. And the idea here is part of this is that we're going to try to build the evidence base and to try to prioritize and share the most effective and actionable strategies for addressing home health hazards. We're going to start off this year by convening a kind of an home health expert committee that'll include folks like Amanda and others, where we're going to come together and try to identify the most impactful tips or strategies, and then we're going to incorporate them into the app. And this allows us to build on Silent Spring's existing kind of digital tools, like our Detox Me app. And the result is that we'll have an app that will, in the end, be available to all that has home-centered, actionable tips that are relevant to everyone, which is great. It's relevant to everyone, but think about, this is just the start. If we're testing this in home visiting programs just in Rochester, Alexandria, it could go anywhere. These home visits happen everywhere. So we're really excited about the scalability of this and developing this resource for families as they're trying to deal with, as Amanda said, 40% of housing in the United States has a hazard. And so I think there's a great potential here to have an impact.
It's just great. It really is just like what Amanda referred to earlier about, the evidence building is important, but it's also important to come up with those solutions and those strategies that people can use. So do you envision it being part of the Detox Me app at some point? Will it be built into that, or will it be a separate app?
Yeah, I think it will eventually be folded into the Detox Me app. We'll test it as its own thing and then eventually try to package it together as this kind of evidence-based exposure reduction tools. Yeah.
It's great. So Amanda, can you regulate the indoor environment? Is that possible? And if so, what does that look like? And what partners or key players need to be involved to create lasting change?
Such a great question. This is an issue that has been on NCHH's wish list for a long time because the truth is, for the most part, indoor air, especially in home environments, is not well regulated, right? And even where we have standards in place, they aren't always health-based or as protective as they could be. A great example of this, I think, is carbon monoxide detectors. Probably a lot of you online, I hope a lot of you online have carbon monoxide detectors in your home. If you don't, you should reach out. I'm happy to give you some advice there. And I think when we put these devices in our home, we think we're protected from carbon monoxide exposure, right? Seems pretty simple. But really, what those devices are set to alarm at is a threshold that is designed to save your life. When carbon monoxide gets to a point where it might start to be life-threatening, it does not actually prevent exposure at lower levels. And when we monitor carbon monoxide sort of continuously in people's homes, you can see that in many of our homes, there's carbon monoxide present, particularly if we have, the gas appliances that we've talked about earlier, other things that might be producing carbon monoxide as a combustion byproduct. And so that's a great example of where we're getting exposures all the time that actually do have documented health impacts. There's literature about that, and we think we have this sort of false sense of security by having these devices in our home. So this is a space where there, I think, is also really ripe for opportunity, and it can be challenging. I'll acknowledge that for a number of reasons, including Robin already mentioned, these exposures are mostly invisible, right? People can't see it. The effects are also sometimes not acute or short term, where, that if it's radon we're talking about and you're going to develop lung cancer 20 years from now, right? That's not necessarily an immediate connection. Or even with something like carbon monoxide, where it is acute, it's also kind of episodic. You leave your home to go to the doctor, you feel better, right? And the carbon monoxide level in your blood is dropping. Even if your doctor thought to test for it, which they probably wouldn't, they might not detect it by the time you sat in a waiting room. It's often difficult to attribute health impacts to a single exposure. And again, thinking about chronic exposures, different levels, the cumulative impacts and interactions, it can get pretty complicated. A lot of these exposures are sort of transient or episodic, right? Where the exposure goes up when you engage in certain kinds of activities, right? Those combustion impacts, byproducts go up when you're cooking, right? But then they might go down when you're not cooking. So that can make it very difficult in terms of monitoring exposure or setting thresholds. We also are sometimes stymied in these conversations by the fact that we sometimes have a lack of good alternatives or solutions to offer. And there's always a strong worry in the field that I work in the unintended consequences of what are well-meaning attempts to sort of regulate exposure, but that can actually cause additional hardship for folks. So in terms of what we do about it, because I think it's important to keep this on our wish list and to keep putting pressure on as a nation to move forward in this way. We need funders to prioritize this work, right? To understand the importance of and the opportunity that's here. We need to continue to build the science and have good science. That's something I think that NCHH and Silent Spring share in common, and why we're so grateful to be in partnership with you. I think there's real opportunities here to get, in conversation with builders and manufacturers and architects and policymakers and people from the health field, and to create more spaces where we can all be talking to each other and identifying those solutions. I think it's important to, Robin, you just mentioned like this exposure reduction tool and the Healthy Neighborhoods program. Many of the kinds of programs and tools you've been talking about today are voluntary in nature, but they help us build the evidence base. They help us demonstrate that it's feasible in the real world. They help us to understand if there are unintended consequences and how we can mitigate them. And they also help to start building the political will, right? The expectation that people, hopefully, we should move to a place in this country where people should have a basic expectation that they are safe and healthy at home. At least I fundamentally believe that. And so I think this, putting these things into practice through these voluntary type programs, which can include research, right? That's exposure. All of these participants in this Rock Home study are probably going to, forever have this seed planted. And a lot of them, hopefully their behavior changed, and they may tell their neighbor, right? Or people at church about what they've been exposed to. And those are impacts, Robin, we're never going to be able to document, right? All of those sort of ripple effects. But I know and believe that they are there. And what we've seen as a stable pattern in the healthy housing field over time with that approach is it starts to be incorporated at the local level or at the state level, right? As there's political will and funding for it. And, over time, the evidence builds about the feasibility, about the benefits, and it really sets the stage for change. So I think we have a great start here, and I'm really hopeful about where this can take us.
Great, thanks, Amanda. So Robin, from a health standpoint, what would you say are the most critical changes that we should be making to improve indoor air quality?
Yeah, so I really do think that a kind of a multi-level approach is needed, because no one single approach will tackle this. So I kind of think about it at different levels, right? So we can think about it kind of at the policy level. Amanda just talked about what could possibly happen at the policy level. From a chemicals perspective, we need to test chemicals for safety before they're even put into products, before they are widely used. We have plenty of examples to learn from, right? Lead in paint, DDT. All of those are great examples of the fact, well, if we just studied its health effects before we actually put it in the wallpaper that we put in our kids' bedroom, that maybe we wouldn't be in this place. And so I do think that that is really important. There's a couple of policy things that can happen. I think that the next level in kind of is thinking about what can happen at the marketplace. I think folks can start pay attention to market-based campaigns, retailer pledges. There are some out there about using safer materials. Your big box stores have certain pledges around different materials that they offer and what they might be in terms of contaminants they might have in them. We also need to ask for safer products. I think people don't realize kind of enough about the power of their voice, the power of their purse as they're thinking about this. Go ahead and ask. I mean, you should have seen the looks I got when I tried to buy the couch, a couch a couple years ago, when I asked, does this couch have flame retardants in them? Now the person at the store was a little baffled, but actually quickly got me on the phone with a regional manager who was able to answer the question and say, no, this line does not have flame retardants in them. And so I think it's important to ask. That salesperson probably never heard that question, but it probably stuck with her. And so if enough people are asking, retailers and manufacturers will start to pay attention. I think there are also things that we can do when we think about indoor spaces that are kind of more institutionally controlled. So for example, we have a whole program called the Healthy Campus program. The reason why we Healthy Green Campus program, the reason we have that is because there's tremendous buying power in higher ed, right? If we could purchase certain materials across an institution that are free of certain contaminants, that could be really impactful. And that can happen through the purchasing decisions, and so kind of bake it into their product specifications. We can also think about things like certification programs and supporting those. Those are third-party certification programs. So kind of still moving in. Of course, there's things that we can do at the individual level, and we have touched on that, the power of individual choices, individual behaviors in the home environment can have a tremendous impact. Of course, it needs to come along with everything else. There's only so much we can do, but there is a lot we can do. And so usually direct folks to checking out our Detox Me app, which I brought up earlier, that has almost 300 research-backed tips on trying to reduce your exposure to many of the chemicals that we are very concerned about from a health perspective. It includes things like keeping dust levels low, vacuuming with a HEPA filter. Simple steps like that can go a long way to improving the health in our house.
Fabulous. Thank you both. I think this is the time when we want to open it up for some of our other guests to ask questions. So if you have a question for Robin or Amanda, please send it to Ask a Question in the chat, and Alex will read it out loud, and we'll do our best to answer all your questions. However, if we run out of time and we don't get to your question, you can email it to Quinn Fye, Assistant Director of Development, at fey@silencespring.org. And Alex, do we have any questions right now?
Yeah, we have a lot of great questions here. I'll see how many we can get through. The first one is, what's the best way to measure indoor air quality? And are there any do-it-yourself or at-home tests to see what certain chemicals might be present in the home?
I can start us off here, Robin, if you want to jump in. I think in terms of the healthy housing fields answer to this question, I mean, first of all, just reminding us, we think about indoor air quality as being broader than just maybe some of the chemical contaminants that we were talking about today. So the common things that we see measured and covered in some of these at-home tools include things like carbon monoxide, radon, particulate matter. You frequently will see sensors include carbon dioxide also. That's not a mistake. The reason that sometimes those sensors use carbon dioxide is when first of all, you can actually have some short-term health effects from exposure to too much carbon dioxide, but it also is a proxy. If carbon dioxide is going up in a home, it's an indication that there's not enough fresh air exchange. And so we can intuit, as Robin said earlier, that other stuff is getting into the house and building up also if carbon dioxide is building up. And those sensors will also, frequently include things like temperature and humidity as well, and for good reason, because those things can be important and to interact with some of these some of these exposures in important ways. For instance, humidity is something that, I mean, first of all, if humidity can cause a problem, if it's too high, it can contribute to mold growth, which impacts indoor air quality poorly. It can become actually a water source for pests, which can poorly impact indoor air quality. But humidity, so then sometimes the response is, well, let's bring the humidity levels way down, right? Like let's keep them way down, but that can actually cause a problem for dust suppression, as Robin mentioned, right? If we get an environment that's too dry and that dust really dries out, it's much easier to kick up and it makes it more available to us. It also dries out all of the membranes in our respiratory tract, and there is some evidence that it makes it easier for it to get deeper into our lungs, and sort of becomes a delivery mechanism, a little ride for some of those chemicals to go deeper into our body. So those can be important aspects if you're looking at sort of different sensors for your home and thinking about the ways that they can interact. There are some of them are really cheap, sometimes even freely available. If you think about things like radon, sometimes radon test kits are freely available in a community. They can be fairly inexpensive. You can buy them at your box store. Some of these things that I've mentioned, we see integrated into devices that people may have in their home. So, like sort of smart HVAC monitoring, where you're setting the temperature for your home. We're seeing sensors built into those kinds of technologies more and more. And you can buy individual sensors. Sometimes they're standalone, sometimes they are combined. They come with sort of different grades of sensitivity. I'm not going to recommend specific products, but there are some general guidelines that people can follow in terms of choosing something that might be right for them. But I think it's also important to note, as you're thinking about these things, a couple of things. First of all, it's not just enough to have a sensor. You got to know how to use it and what you're measuring. Radon's a great example there. In order to get sort of a proper understanding of your risk from radon exposure, the sensor needs to be placed on the lowest level, the lowest occupied level of your home, right? So whatever level of your home you spend any kind of significant amount of time in, that's the level it needs to be on. And it needs to be out for a specific period of time. And you need to not have unusual conditions, right? Like if you set out your radon detector on a beautiful spring day when you have your windows open because it's a beautiful day, but that's not usually your general pattern, you're not going to get an accurate picture of what the radon levels are in your home. And like, spoiler alert, that's also important if you're buying a home, to understand the radon testing results that are coming back from you and what the testing conditions were there. So it's really important to think about all of that, and even understanding, as I mentioned, that a lot of these exposures are episodic in nature. So really sort of like looking at patterns over time. Again, it doesn't necessarily give you a full picture of your indoor air quality to measure it at a time when you're not cooking. If, on Sunday you spend the entire day in the kitchen with your gas stove running the entire day, that indoor air quality is going to look different that day. So I think that there's just a lot to say here. And I think, a really important message here is that even more important than testing for all of these things, and in some cases testing just doesn't even make sense, is just source control. Where we know the source is an issue, we don't need to spend money on testing for it. Like, let's just work on actually that exposure reduction and that harm reduction and get it out of our homes entirely.
Great, thank you. We've had a number of people actually ask, this is a very specific question now. A number of people want to know more about what a Corsi-Rosenthal box is and how it works. If you could just, Robin, maybe say a little bit more about that, that'd be great.
Yeah, so a Corsi-Rosenthal box is it's actually this cube that is made with materials that you could buy at your local hardware store. And so what it is basically is, it's named after Corsi and Rosenthal, the two engineers that kind of brought this together as a DIY approach at the very beginning of the pandemic. But it basically can be in different configurations, but you take the filters that you would typically put in a mechanical ventilation system inside of a house that you can buy at a store, so that you want them at a certain rating. But you take 4 filters, and these are kind of paper-based filters, cellulose filters. And then you put a box fan on the top, with the idea is that you draw air into the cube across the filters. By pointing the fan up. So the air comes into the filters and then gets moved across the filters and then up and out. And it kind of creates this big circulation. And the coronavirus the virus particles actually get stuck to the filters, but also anything else that likes to hang out in particles. So things like phthalates, PFAS, any number of contaminants inside the house, even just particulates themselves get stuck on the filters and actually then are removed from the indoor air. So it's basically, you can probably make it between $80 and $100 with 4 filters, some duct tape, some cardboard, and a box fan. And it's a pretty straightforward way that can have a big impact.
Thank you. We have a lot of questions too about people just wanting more advice on how to create a healthier home. Like, what are some of the things they should really be focusing on? How do they know how to buy, make safer choices in the store and things like that?
Yeah, I mean, that's a broad question. That's actually why we're here.
But so for instance, you talked about like controlling dust. Are there other things that people like, what are sort of on your top list of things that people should be doing in the home?
Yeah, I mean, I think Amanda's touched on them too, but I think generally there's things like keeping dust levels low will go a tremendous distance. Ventilating as much as possible. And of course, thinking about source control, thinking about the products that you're bringing into the homes. And when I say products, I mean, even like your flooring choices. Are you bringing in a large area rug? What is it made of? Or it can be the personal care products that you're using or your cleaning products. Thinking about source control and then thinking about dust control and thinking about, we think about air control or ventilation inside of the house.
I would just add to that and say I like +1 to everything that Robin just said. And there are some great resources, and I can provide it to our colleagues at Silent Spring for any follow-up after this event. The aligning even with those keep it principles we shared before, which a lot of times residents find it kind of like easy to organize their thinking around that, and some really great resources with step-by-step guides that people can follow in terms of keeping their homes dry and pest-free and contaminant-free and safe, and on and on.
Related to this too is there's a question about what are the top 10 most important healthy material choices we can make as architects. So thinking about building materials.
Will unmute myself here. This is another really great question, and I think there are a number of really great partners working in this space to help us identify and take the kind of science, right, that Silent Spring is doing and translate that into action. So, for example, there are friends at what was formerly the Healthy Building Network, now called Habitable. They are doing great work in identifying building material suggestions that are safe for the people and for our planet. There's a safer chemistry impact fund that's also doing some really important work in this space to not only identify chemical exposures that may be a problem, but really having a strong emphasis on identifying sustainable and accessible alternatives. Just recognizing that behavior change is really hard if we don't have an alternative to offer someone. So I think there are just a number of really important efforts that are being funded in this area that should hold a lot of promise for the field over the next decade.
Yeah, I also think, just to add to that, I think, yes, there's incredible resources already out there. I also would suggest that maybe people can also act almost as like junior exposure scientists, thinking about what are the spaces, the surfaces that could lead to the greatest exposure potential, right? So when I think about this, I'm thinking about things like, what are we putting on our walls? What are we putting on our floors? Those are huge surfaces inside of our house. And so kind of thinking about, if you want to kind of prioritize things, think about the potential for exposure from anything that might come out of those materials. So kind of put on your thinking cap at the same time as you're accessing all these incredible materials that are out there by our partners.
Can low-income families get support for HEPA vacuum cleaners and or air filters? If so, how?
The unfortunate answer there is it kind of depends upon where you are and what resources are available in your community, because it's kind of a patchwork solution. So, if your community has a HUD grant or, a similar type program funded through another federal agency or a private foundation, or a home repair program that has a more expansive view and will cover that kind of equipment. You may have programs that you can rely on and reach out to gain access to those materials. We've seen in some communities the emergence of leveraging the public library system to make these types of devices more available, particularly HEPA vacuums and some other indoor air quality devices through the use of lending libraries. We've actually, just this weekend, we were borrowing some power tools from our public library, and my husband sidled up to the counter and said, "What are you guys doing about, indoor air quality, HEPA vacuums, HEPA filters?" And they actually surprisingly said, "Hey, we're trying to think about that. Do you know about this?" So we're seeing this kind of movement take off. In some cases, depending upon people's insurance and the coverage, we've seen over the last 2 decades an increase in some health plan insurance coverage for providing these types of devices as a comprehensive solution for people who have asthma or other conditions. So there are a variety of different mechanisms where it may be available, but there's not a one unified great solution. And again, because I think of some of the uncertainty of the funding streams that have supported these programs, probably that the availability is going to become even more patchwork, at least in the short term, until we figure out another way to get it financed.
Someone had an interesting comment about, interesting to think about where all those contaminants go after you vacuum or mop them up down the drain to the landfill or the incinerator. Wanted to know if you want to comment on sort of the life cycle of these chemicals.
I think that it's a really important topic. I mean, I know there's been a lot of research around that, for example, with flame retardants, right? What do you do? So say you don't want a couch full of flame retardants. What do you do with it? I think it's a complicated thing. I think it's important to think about the life cycle of that. But I guess it's kind of going back to the first point, which is source control. We don't have to deal with it from a life cycle perspective if it's never actually introduced. And so thinking about source control can actually be really important here.
I'll just add another example because I do think it's an excellent question of how this comes up in the work that we do. So sometimes communities, one of the ways that they might be interested in increasing protection from lead is through lead safe demolition, right? When we're demolishing buildings, we don't want to create these big dust clouds and spread lead dust into the neighborhood. So a lot of the policy, we have model policies that communities can adopt to increase protections during that process, and they don't cost a lot of extra money. A lot of it just is about working wet, right? The same kinds of strategies, Robin, you were talking about in home, like using damp cleaning. It's that on a much bigger scale, right? In terms of dust suppression methods outside. But an interesting part of the model policy is also about the disposal of materials. What do you do with those old leaded windows and components? And I mean, first of all, I think we know in many communities, it's very trendy to like upcycle old, sort of architectural components. And in many cities the same cities that might be really interested in being really progressive on protecting people from lead or other environmental exposures also tend to have really progressive climate agendas. And that may include actually the directive to put those kinds of components, instead of putting them into a landfill, putting them back into circulation. And so that sometimes becomes like a little bump in the road that we have to sort of help educate local decision makers about, that like, yes, this climate agenda is important. And at the same time, we need to make some exemption for these lead contaminated doors or windows or other components. So it can be, something that has to really be thought about and addressed. And I really appreciate the question.
Related to lead, there's a question here about with the Rock Home study, when you looked at before and after lead mitigation, did you collect data on what type of mitigation was used? So scraping versus, say, encapsulation.
Right. Yeah. So there are standard protocols that they use as they are doing this lead rehab work. Just for a little bit of background for folks, what happens is basically the city offers a grant, and with that money, a contractor is hired who is certified in these appropriate methods for mitigating lead. And so yes, we have, although it's a tremendous amount of data, but we have what's the scope of work for all of our residents. The National Center has actually shown that the importance of understanding some of your results or looking at your results relative to the scope of work or the amount of work that's been done. So we have plans to look at that, look at the associations. We can say overall the lead levels went down, but did they go down more depending on certain kinds of work that was done in the house? And so we plan to look at that.
And I can just add, I was just
yeah,
going to
go
add,
ahead.
like in general for lead hazard control interventions, people tend to think about it as like interim controls, like we're just dealing with, we're sort of stabilizing paint versus, abatement, which might be either permanently removing or, permanently safeguarding against future exposure. And the line is often not completely clear in the way that homes are going through lead hazard control. Sometimes there is a mix of both interim controls to stabilize, deteriorating paint, but then abate other components, particularly things like windows and doors, or encapsulating porches, sources of major exposure. So sometimes it's not even an either or, it can be a combination of approaches.
I think we have time for maybe just one more question. This one's sort of very general, but do you have any specific tips for households with children? Specific things that folks should consider if they have children?
Sure, I'll start it off and then Amanda, you can fill in. But first of all, I think we need to think about children are particularly vulnerable to some of contaminants inside of our homes. So that's mostly because children's behaviors are different than adults, right? Kids spend a lot of time hanging out on the floor. They have a lot of what we call hand to mouth activity. They're constantly putting things up into their mouth. So I think we have to be very careful about contaminants inside of the house that can end up in dust, because children can be exposed and has been shown to be more highly exposed to chemicals like flame retardants that tend to be in dust. Again, I kind of circling back, it's source control and it's also lowering dust levels. It is actually one very simple kind of approach or step that people can take is always washing your hands before you eat. Kids eat with their hands too. They play with their hands. Washing kids' hands before they eat has shown to actually reduce their levels of flame retardants inside their bodies.
Yeah, I would amplify all of that and say, in addition to their behaviors, children are not little adults, right? They also breathe more air and eat more food and drink more water per pound than adults do. Their systems are more vulnerable at critical development windows. So the impact of lead exposure looks different in children than adults, although adults are impacted by lead also. So it's, their behaviors are part of it, but also just they're affected differently by even the same levels of exposure. And I really just want to double down on the source control part of this, because for many of these exposures, as we talked about that sugar packet example with lead, you cannot clean your way out of this, right? And for a long time, like that's the message to like parents is like, you just got to wash your kids' hands all the time. I have a 5-year-old, like there's no amount of cleaning that I could do to protect him from exposures, even at 5, let alone when he was 2 years old, right? And so I think it's important to, utilize the cleaning for some of the kinds of exposures we're talking about. There are dietary supplements that can help, for like heavy metals in the body that, can compete for the same receptors to sort of mitigate some of the impacts, but those are not complete solutions. What we really do need to do, as Robin said, is first of all, try very hard not to get these things into people's house in the first place. And when they're already there, do whatever we can to get them out. And a final point here that I think is really important is we don't also want to wait until people are harmed by this, right? We don't want to wait until somebody shows up with a health outcome. If we just stick with the lead example, that's the main way we discover where lead hazards are in this country is a kid shows up with an elevated blood lead level. That is a terrible way to find out about an environmental exposure after a kid has already been exposed and harmed. Like we can do a lot better than that as a country. So not only should we be investing in source control, but we should be doing it proactively before people are exposed and harmed.
Great, thank you. Thank you. So Beth, I think unfortunately that's all the time we have for questions. I'm going to pass it back over to you, Beth. Thank you.
Great. Yeah, that was such a great discussion. Thanks, Alex, and thanks, Robin and Amanda. I think we can all agree that everyone deserves to live in a space that's free of health hazards. And because of generous individuals and organizations, and despite what's happening with our friends in the federal community, we're going to keep doing all we can to create healthier homes and a healthier world for everyone. So please stay tuned. for information about our most important fundraiser, which is our gala celebration on October 9th. And if you have a question that didn't get answered, please again, email your question to Quinn Fye, Assistant Director of Development at fey@silencespring.org. We are going to also be emailing you a link to the recording when it's available, so keep an eye out for that. And I think we'll be sending some resource materials, also some links and so forth. And if you would like to learn more about getting involved in Silent Spring, please reach out to Quinn at, again, fey@silencespring.org. Thanks for joining us and have a wonderful rest of your day.